guys, what's up? This is the Midwife and the Medicine Man. We had some pretty crazy stuff going on today. Some stuff that probably a lot of people deal with.
That was kind of wild, yeah.
Yeah, it was busy from the start.
From the very, very start, yes.
Pretty
as soon
much.
as we walked in the door, yeah. It got crazy,
and
quick.
You know, we always talk about like me and Stacey working together doing stuff, but today we had like a little scenario where it like brought together
exactly what we
things.
do. Yes, like we both needed to be in there. Yes, definitely. Yeah.
So there's a pregnant lady, obviously.
Yeah.
Coming in with some mental health, depression, anxiety stuff, and trying to figure out what's going on with her.
Right. Yeah. And you know, I've taken care of her before, so we kind of knew that there's a little health history there in her family with some mental health, and she's had some issues before, but not quite like this time. So as soon as I started to assess her, I was like, yep, I think we need to get Matt involved in this, and let's figure out what we need to do for her to get her to feeling better quick. Yeah.
Well, you know how. Well, I don't know how it is when you get pregnant, but you know how it is when you get pregnant.
Yes, I do.
Your emotions go crazy sometimes.
Yeah.
And I think the husband probably recognized it.
Yes, he did.
I think so.
Yes.
And she did too. Yeah,
she didn't know how to deal with it.
No,
she didn't know how to address it. She didn't know what was happening. She couldn't explain it. All she could do was cry.
That's what she was doing.
Yeah.
That's what she was doing.
Yeah.
She got I guess when you get pregnant, the hormones and stuff, and I think she had probably a little underlying depression going on with it.
Yes, I think so too.
But the bad part is this is something that not a lot of men, but especially women, don't really want to talk about. They want to be strong. They're pregnant.
Exactly.
They want to be happy about that pregnancy.
I'm supposed to be happy.
They're sad.
Yes.
Has nothing to do with the baby or the pregnancy.
No.
Obviously.
But,
yeah. Stacey got her fixed up on some blood work and trying to make sure she doesn't have anything out of balance there, and we want to treat her naturally, obviously.
Yeah, we're gonna, but I think she was a little past that point.
Yeah.
I think that we needed to get something done now.
Yeah, I agree with that.
Before some really negative things started happening. So we decided on a treatment of a mild prescription and also some natural alternatives too.
Yeah, and of course after we check her blood work, vitamin D and mental health stuff, that all kind of plays into your mood. But there's a lot of things that that people want to try when they're pregnant that are not safe. A lot of people think, well, I can take valerian root, or I can take, and some of those things you don't want to do.
No.
It's natural doesn't mean safe.
Exactly, and I think
that's
kind of that's what we run into a lot. They're like, oh, but it's all natural and it says it's safe, but there are herbs that are not safe during pregnancy. There are herbs that are also safe like later in pregnancy, but not in the first trimester. So you really need to be careful with that. And that's kind of what I was afraid we were going to run into with her. Was
They want to do the natural way.
And they do. They want to do the natural way, and I'm all for it. I think that's great, but I think that she needed a little more intervention than that.
And that's kind of where that's where it's nice, because having that blend of like we can talk about the natural stuff and the prescription thing, and they not always receptive to that, but in her case, I'm like you. I think we're on the same page. It needed to be a little bit more aggressive and something a little quicker.
Yes.
And definitely the prescription thing is perfectly safe while you're pregnant. It's been thoroughly studied, and so that was somewhere an area where we thought, okay, complementary. Let's do the natural. Let's do the prescription.
Right.
And I think we kind of, which was funny it was just funny today being in that, how like both of our worlds kind of blended in one little scenario. Which happens all the time.
And it does happen all the time. But this was a perfect example of, hey, we need to do something quick. We need to do it now. But we can also do both worlds, if that makes sense.
Okay.
And that's okay. There's nothing wrong with that. And that was a talk that we had with her that, lots of women have these issues. Lots of people have them. And it's okay.
Absolutely.
And it's okay to ask for help. And it's okay to say, yes, I need help. And, we also had a discussion with her about, like, getting help at home. She has lots of children, and she needs help. I need a helper. I want to help her.
Yeah.
I'd love to have a helper. But
I need some help at home, but I don't want to have that many kids to get that help.
Me either. No, I only have, most of my kids are gone. They're out of the house. I still need a helper. But
maybe that's a new. Maybe rent some kids.
That's a good idea. That's terrible.
If you have depression,
don't scratch. He did not say that.
Here's your natural treatment. Here's your prescription, and here's some rent kids.
Here's some helpers.
Rent a kid. I'll do that later. My second life.
Okay. But we did have that discussion. It was her getting help at home, and so that she didn't feel so overwhelmed, because I think that is some of it. Is that she is like, I have all these things to do. It's the season, they're planting, they're going to be harvesting, they're going to be canning, and all these things. And she also has multiple children, so she's responsible for a lot. So I think it was really important that she felt like this was okay.
Mm-hmm.
And
it's okay to feel that way.
It's okay to feel that way. That does not mean that there's something wrong with you, that lots of people have those emotions, and that we can help her, and that we want to help her. And it's okay to ask for help.
Yeah. And it was, as I just said, to reiterate, it's kind of cool just to see those things kind of blend together.
Yeah.
The whole pregnancy and natural and prescription and how all that kind of came together.
Yeah.
So it was a cool little dynamic.
And we do the labs to check things like Matt said, and so that we're not guessing on everything. Yeah. But it was a good day, and I will follow up with her soon.
See how she's doing.
Of course, we'll continue to follow up the whole pregnancy.
Yeah.
But until we get her figured out and make sure she's happy.
Cool. Yeah. We'll be posting more stuff like this. Keep up with this. Midwife and the Medicine Man. We'll be on YouTube, Facebook. Check us out.
Oh yeah.
And we'll be doing some more stuff like this. Let us know what you want to hear about, and we'll kind of share some, more stories as we kind of do this. We work together almost on a daily basis, so there's going to be lots of that going on. So
lots of fun, lots of weird stuff.
Yeah.
Too.
And we'll keep you updated with those stories. Some of those stories are get out of hand. You may not want to hear it.
No, you might not.
So keep up with us on here. So appreciate you guys listening.
Yeah.